course, there is so much uncertainty surrounding the COVID-19 pandemic. So we wanted to try to clear up some of the unknowns about the virus. Let's bring in Dr. Ahmed Firas Khalid of McMaster University. Doctor, thank you so much for joining us. You've been incredibly helpful thus far. So here's some of the questions. I'm sure you've received so many questions from your patients. Here's one that came in. Spring allergies, bad case of the flu, or COVID-19? How can I tell the difference?
That's a great question, and good morning. I'm glad to be here again. So the big difference that we're seeing is that with allergies, you're really going to see the common symptoms of an itchy eyes and a runny nose. You're not going to see those in COVID-19. Actually, as a matter of fact, almost 90%, more than 90% of people that tested positive for COVID-19 had a fever, cough, chills, and shortness of breath. So those symptoms really help us to differentiate that from allergies. And now today with spring here, I think many people are getting that confusion and it's causing a bit of a stress on everybody.
Good to know. So here's another one. If I get COVID-19 and recover, can I get it again?
Yeah, we're hearing this question a lot. So the World Health Organization put forward a statement saying that they suspect that people who had COVID-19 and recovered will be able to have a stronger immune response to COVID-19 if they get it again. However, we don't know how strong that immune response will be and how long it will last for. I think time will really tell us on how that response will look like over the coming months.
All right, a lot of people are hoping for this next question and looking for the answer. Will the summer season, the hotter temperatures, kill COVID-19?
Yeah, so we've heard all kinds of questions when it comes to temperatures. We've even heard reports of people increasing the temperature in their own homes, which is a bit ludicrous. The short answer to you is that the virus can spread in any temperature. We've seen cases of COVID-19 in colder areas of northern China, but we've also seen it in Singapore and parts of Africa where the temperatures are hotter. The World Health Organization does suspect that we might see lower number of cases over the summer season just because of the nature of the virus itself. But also, again, we've seen it in all across types of temperatures.
Just on a side note, it is kind of fascinating because we're only a few months into even understanding what this virus is, aren't we, in terms of people trying to understand what it does, where it could go, and really a means of tackling it.
Well, that's precisely why segments like this are so important. I think many of us in health policy are trying to advocate for the correct information out there because it is a new virus, exactly how you said it. And so there's a lot of circulating information out there, and it's going to become more and more important over time that we really differentiate between what's fact and what's fiction.
All right, I want to get to the next one. Here's one. We heard reports of a vaccine or a medication being developed. How long before we can all have access?
It's a great question. I think in best case scenario, we're looking at 12 to 18 months. And I know that sounds like a very long time, but in the science world, that's actually not that long because we need to make sure that there's no adverse effects. And by that, we mean we really got to make sure that this vaccine is safe for people, and that will take time for it to happen.
Yeah, so on that front, the human trials have begun. I know in the United States at least a couple of weeks ago, so it's going to take some time. Here's another one. Should I disinfect my groceries or deliveries by bringing them before bringing them inside the house?
Yeah, so the great question, and the answer is yes. You should exercise precaution with your packaging. We've seen the virus survive on packages. And the simple things is clean the surface of the package when you get it. Wash your hands before you open the packages. Dispose of the packaging right away. So that's really, really key. That's a key message to put out there. As soon as you open the package and you get your groceries out, get rid of that packaging in a lid outside. Wash your vegetables the normal way you do, and then clean your hands once again once you're done.
Yeah, because it's really so basic, isn't it? Just wash your hands, don't touch your eyes, and just really be very, very cautious of that. Now, on that front, here's another question that a lot of people are asking, and some misunderstanding and sort of miscommunication with this. The issue of a face mask. Should people wear them?
Yeah, so we've seen this resurface again and again, and this is why it's so important to readdress it. The simple answer is no, you should not be wearing a face mask if you are a healthy individual. So you exhibit no symptoms of COVID-19, you haven't been diagnosed with it, nor are you taking care of somebody in your house that has COVID-19. The reason for that is quite not that complicated. Number one, we worry that the face mask is not being fitted properly on people's nose, cheeks, and so that can cause actually a spread of the infection. So we don't want people to wear masks that are not properly fitted. And hence why you see many public health agencies, including our own CDC in the US and WHO, still sticking to the same thing, which is keep the face masks for our healthcare providers. They are in shortage, as you earlier mentioned in your segment. We need to make sure that they are safe for our healthcare system to be able to flatten that curve.
Incredibly helpful advice. We got to have you back and answer some more questions. Dr. Ahmed Firas Khalid, as always, thank you.
Thanks, Anthony.